Next is about sarpadashtavishakalp23 kalpam व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः धन्वन्तरिं महाप्राज्ञं सर्वशास्त्रविशारदं पादयोः उपसङ्गृह्य सुश्रुतपरिपृच्छति सर्पसङ्ख्यां विभागं च दशलक्षणमेव च ज्ञानं च विश्ववेगानां भगवन् वक्तुम् अर्हसि. Now the chapter starts with the student demanding the teacher to teach about the snakes, snake poisons and the possible complications produced to that. तस्य तद्वचनं श्रुत्वा प्राभवीद्भिषयामरः असङ्ख्या वासुकीश्रेष्ठा विख्याताः तक्षकादयः महीधराश्च नागेन्द्राः हुताग्निसमतेजसः ये चापि अजस्रं गर्जन्ति वर्षन्ति च तपन्ति च ससागरगिरिद्वीपाः यैः इयं धार्यते मही क्रुद्धा निःश्वासदृष्टुभ्यां ये हन्युः अखिलं जगत् नमस्तेभ्योऽस्ति नो तेषां कार्यं किञ्चित् चिकित्सया ये तु दंष्ट्राविशाः भौमाः ये दशन्ति च मानुषान् तेषां संख्यां प्रवक्ष्यामि यथा वदन् पुरुषः. Now, as far as the snakes are concerned, from the Indian epic point of view, snakes are considered as divine entities. The whole universe is supposed to be kept on, or the earth is over the head of the Sheshanaga, one of the Naga as such, Vasuki. And Sushruta says there are so innumerable numbers of such varieties of the Divyas, or the divine snakes, Nagas, and they are supporting the earth, and they have a very, very high capacity, and because of their activity, the rain comes in, clouds they are formed, and the whole universe of both ocean as well as the land is supported by the divine Nagas. And if they become angry, the whole universe will be destroyed. And Sushi says they need to be worshipped, whereas if they have nothing to do with our chikitsa, natesham karyam chikitsa. With the chikitsa, there is nothing to do with these divine entities. Instead, all that treatment of poisoning and issues of poisoning comes in only in the earthen varieties of the earthen species of the snakes, and they are called as bhaumas. So whatever the discussion would be, it would be related to the bhauma, or those which are in the land and which can produce a injury by bite. अशीतिस्तु एव सर्पाणां भिद्यते पंचधासु सा दर्वीकराः मंडलिनः राजीमन्तः तथैव च निर्विषाः वैकरञ्जाश्च त्रिविधाः ते पुनः स्मृताः. दर्वीकराः मंडलिनो राजीमन्तश्च पन्नगाः तेषु दर्वीकराज्ञेयाः 20 षट्पन्नगाः 22 मंडलिनः राजीमन्तः तथा दश निर्विषाः 12 ज्ञेयाः वैकरञ्जाः त्रयस्तथा वैकरञ्ज उद्भवाः सप्तचित्राः मंडलिराजिलाः. Now, according to Sushruta, there are 80 types of the snakes in this universe, and they are categorized again into 5 categories based upon their shape and their impact as such. And those are Darvikaraha. Darvikaraha are hooded snakes which have hood-like structure. So Darvikaraha, Panavantaha. And Mandala are those which do not have a hood-like structure, but they have some circular or some line-like appearance over the surface, over the body surface, circular lines like over the surface. Then Rajimantaha, where there will be multiple color, which different types of these lines are seen over the surface of the body. They are Rajimantaha. Nirvishaha, that's so according to Dallane again, Mandalinaha Panamarjitaha Vivida Mandalihi Chitritaha, where there are some circular lines over the area. Rajimantaha Rekhayuktaha, straight lines over the surface of the body. And Panamarjitaha Ishadvishaha Gamaladayaha. The Nirvishaha are those which are non-poisonous or little poisonous. Then Vaikaranja are Sankirnajataha. Now, this is again very interesting issue. Sushruta says when there is a mating between two types of the snakes, different types of the snakes, a sort of hybrid snake is formed, and that hybrid snake is a Vaikaranja. Vaikaranja is a Sankirnajataha, produced due to the union of two different types of the snakes together, and hence they are called as Vaikaranja. And the numbers are Darvikaraha Mandalinah Darvikaraha Jnayah Vimshatihi. There are 20 types of the Darvikara, hooded snakes. Sharcha Pannagaha, 6 of the Pannaga are which are having just a straight like body and they tend to move in a curved manner. And Mandala, those which have a circular lines like crates, like snakes. Dvamshati, 22 varieties are there. And Rajimantaha, where there are lines, there are 10. And Nirvishaha Dvadasha, Nirvisha, without poison, they are called as they are numbered as 12 types of them. Vaikaranja Trayaha, Vaikaranja, there are 3 of them. And from the Vaikaranja, those which are hybrid snakes, there again there would be the further progeny are again have 7 subtypes as such. So that's about the biology of snakes mentioned in Sushra's period. As far as the current biology point of view, the snakes belong to phylum Chordata and Reptilia class, Squamata order, and Ophidian clade, suborder Serpentes. And in the Serpentes, there are more than 2,900 species identified. And these species are subtyped into 5 types as such. And these subtypes are colubrids, elapidae, boas and pythons, rattlesnakes, and ball python. And among them, elapidae are more poisonous snakes. And from Indian point of view, majority of the snakes which are the cause for these snake bite and poisons, they are either elapidae or rattlesnakes, which are common as others. Of course, they are quite common elsewhere too. And as far as the WHO as such, the up to 1.8 million bites from venomous snakes annually. Among them, venomous, those which have venom, they are comparatively lesser, and the snake bites are 1.8 million bites as such over the world, causing 20,000 to 90,000 deaths in a year. India accounts for approximately half of the worldwide snake bite deaths as such. These are certain of the important data. Now, the snakes bite due to Padhabhimstaha, Dushtava, Kruddhava, Grasarthinopiva, Te Dashanti Mahakrodaha Trividam Bhimadarshanaha. The snakes, they are called as Mahakrodaha. Their appearance itself looks like they are very angry, and their behavior also looks like they are very angry, and they tend to bite when they come into contact with the foot, or when they are maybe handled by the foot as such, when persons are walking or doing work in the field as such, or when the snakes are hungry, they may misunderstand the human body as the food and they may bite over that, or some of the snakes are dushtaha, they by themselves they are wicked as such, and they may be angry also. Anger also can produce this, and they may bite due to any of these reasons as such. The types of the snake bites or the possible impact on the body would be of different types. Now, usually we categorize them as dry bites and mild and moderate venomous bites like. And Sushruta has classified the complications or the presentation of the snake bite, intensity of the snake bite as sarpitam, raditam tapi, tritiyam asa nirvisham, sarpanga abhyatam kechidichanti kalu tadvidaha. The types of the snake bites, by looking at the intensity of the snake bites, either it could be nirvisha, some of them are non-poisonous, and some of them others are sarpita, radita or sarpangabhyata, the other 3 varieties which are really poisonous, and nirvisha is non-poisonous. Padani yatra dantanam ekam dveva bahuniva nimagnani alparaktani yani udrutya karodihi chanchu malaka yuktani vaikritya karanancha sankhiptani sashofani vidyaptat sarpitam bhishaka. Sarpita are where you may see the tooth marks or the fang marks of the snakes, either 2 or more, 1 or 2 of these fang marks or the teeth bite marks are seen, and they are deep, but there is not much of a bleeding, and there you may have a shape which is something like a mala, something like the garland like appearance, or maybe what you see that oral cavity. So almost the whole denture is bitten. Such conditions are called as sarpita, which is relatively more intense bite, where the jaw of the snake has produced its full impact, and the fangs, the poisonous, venomous structures also are seen. Then Rajyaha Salohitaha Yatra Nilaha Pitaha Sitastha Vijnayam Rajidantatu Jnayam Alpavisham Chatat. When there is only a superficial abrasion but not deep one, and either there could be a pallor or there could be a hyperemia, reddish color, that kind of a injury, it's a relatively mild injury, and where the possible amount of contamination or venomization would be lesser, and that's considered as a radita. Radita is a mild injury. Then ashofam alpadustasaka praktistasya dehinah padam padanyam vidyanga vishamta chikitsakaha. When there is no swelling and there is not much of any edema or no bleeding, and the patient is normal, that's called as avisha, nirvisha as such, where there is no poison. Sarpas prastasya birohi bhayana kupito nilaha kasit kurteshopam sarpanga abhyatam tada. Sarpanga abhyata is where there is really no bite as such, but simply because the person has come into contact with the snake because of the fear, simply because of the fear, the patient may have a feeling like there is a swelling in the area, and that's called as sarpanga abhyata, where there is no real venomation, the venom has not really contaminated, but simply because of the mechanical contact, the patient has the appearance. Of course, in the present day situation, in the toxicology, we depend upon the study the bite marks, which are very important criteria to decide like whether there is a real poisonous snake or not. The poisonous snakes also are identified by their shape of the head. The poisonous snakes, their head would be somewhat pointed or triangular, and the pupils are elliptical, whereas non-poisonous, the head is somewhat rounded and the eyes also, pupils also are rounded, and the bite marks, in case of the poisonous snake bites, the bite marks would show the fangs which are the real structures which produce inject the venom. So they are seen beyond the line of the jaws, and that's the evidence of the snake bite and poisonous snake bite. Whereas non-poisonous snake bite, it may be only the signs of the jaw seen, upper jaw or the lower jaw signs are seen, and that's how one of the criteria to decide whether the wound is really poisonous or not. In the standard clinical guidelines, the snake bite grades are made out based upon the clinical signs. They are based and they are categorized into 5 categories: dry bites, minimal envenomators, envenomations or mild envenomations, moderate envenomations or severe envenomations, depending upon amount of the venom which has been injected in and which has produced the clinical entity. And dry bites are where there is no venom deposition, something like the nirvisha, and therefore there are no signs and symptoms beyond the puncture wound, and it is estimated that 10% of the pit viper bites and 30 to 50% of the coral snake bites are dry. So quite a large number of the snake bites are dry bites where there is no venomation, and the specific anti-venom treatment may not be necessary, but the problem would be to decide which of them have the real venom or not. And this is based upon the clinical signs, and those which have a minimal envenomations, where there is very little amount of venom has been transmitted, they are characterized by the local findings such as bruising, tenderness, and the immediate adjacent to the bite site, and absence of laboratory abnormalities or systemic findings. That's the mild radita, something of that sort. And mild envenomations, these are lack laboratory abnormalities and systemic findings, but the local damage extends several centimeters from the bite site and all the way to a major joint, very close to a major joint, then it's a mild. It's also a sort of the radita mentioned by Sushruta. Shofa is there, but not much of a poisonous signs. Then moderate envenomations, where there may be associated with non-life-threatening signs and symptoms like vomiting, hematoma. We will come to the symptoms later on. So symptoms are seen, but doesn't extend beyond 2 joints. The local damage doesn't extend beyond 2 joints. Severe envenomations are where there is extensive local damage as well as there is a systemic toxicity, hypotension, airway swelling, etc. can occur. So that's how it is classified in the present day situation, and whereas Sushruta has classified them under the similar context, this concept, but the grades are somewhat defined in a different manner. व्याधित उद्विग्नविष्टानि दष्टानि ज्ञेयानि अल्पविषयाणि तु तथा अतिवृद्ध बाल अभिदष्टम् अल्पविषं स्मृतं सुपर्ण देव ब्रह्मर्षि यक्ष सिद्धनिषेविते विषग्नौषधियुक्ते च देशेन क्रमते विषम्. The amount of the poison or the venom of a snake is depending upon the status of the snake acid. If the snake itself is diseased or if it is already disturbed, and some of them, they by nature they may have a lesser venom formation as such, or very old or very young snakes would have lesser poisonous substance or venom in their fangs, and hence the amount of the symptoms would be milder. Similarly, Sushil says those which are in a auspicious location like a temple or where the rishis are present, the rishi ashrama or yaksha siddha nishevitas, at auspicious locations, or in those locations where certain of the vishagna plants, the non-poison neutralizing plants are grown, such snakes would have a lesser impact of the poisoning as such. The shapes and the classification of these snakes like Mandala, Darvikara, etc. are based upon their shapes and appearance. The Darvikara are Rathanga, Langala, Chhatra, Swastika, Ankushadharinaha, Jneyaha, Darvikara, Sarpa, Panina, Shigragamina. In the Darvikara as such, you will have a hood which may resemble like that of a Rathanga, that's the flag over a cart, or like a umbrella or swastika, or different shapes of that snake hoods may be seen, and they are called as a phani, and they are moving very fast. Elapidae, majority of the Elapidae are of the same shape as it. Then Mandalehi Videshchitraha Pratho Mandagamina Mandastu Te Smritaha. The Mandagamina Mandala are where there would be circular lines like which are often seen in pit viper or crates as such. Then Jneyaha Mandalya Sarpaha Jwalanarka Samaprapaha Snigdaha Vividha Varnabhi Tidya Gurdham Jarajibhi Chitritayo Bhantite Rajiman. The Rajiman, where there are some lines, either vertical or horizontal lines seen, again commonly seen in case of the crates as such, where such of these pattern is seen over the surface. Then in Sushruta, there are certain sub-classification of the snakes of different categories based upon their appearance. This is a very interesting issue. And based upon their shapes, they are categorized into Brahmana, Kshatriya, Vaishya and Shudra. And of course, the impact of the poison also would be depending upon this category. And the classification is based upon the appearance, the color. So each type of the snake, maybe Arapidae or the Scorpidae, you will have these appearances, different colors, and based upon the colors, they could be categorized as Brahmana, Kshatriya, Vaishya, Shudra. Unlike as in case of the human beings, it's not a caste, but it's about the appearance and their behaviors which can be mentioned. Now those snakes which have Mukta Rupya Prabaha, which have either like that of the coral or maybe the silver, shining appearance, Kapilaha, either it could be brownish color, Sugandhaha, which may have a pleasant smell, Suvarnabha, which look like a gold, the golden appearance, they are called as Brahmana. Of course, the different colors of the snakes, you will have multiple variations in the colors of the snakes depending upon the location as well as their genetic material. Now, Sushil says such of those which have a yellowish or whitish color, pale and shining appearance, they are called as Brahmana. Kshatriyaha snigdhavarnasu pannagaha bhishakopanaha surichandrakasichatra lakshma tesham yatha tata ambujam. They are Kshatriyas are mainly located in water snakes mainly, and they have a deep color or what we call as the strong color, and there could be shapes which resemble like sun or moon, roundish shapes over the body. Such are called as Kshatriya. Krishnaha Vajranibhaya cha lohita varnatasra dhumraha paravata bhashta veshaste panaga samtaha. Those which are compared to blackish color and they have very shining appearance like that of the diamond, or maybe reddish in color or greyish in color, they are called as a Vaishya. महिषद्वीपवर्णाभाः तथैव च परुषत्वचः भिन्नवर्णाश्च ये केचित् शूद्रास्ते परिकीर्तिताः. If the skin is rough and they have appearance like that of a buffalo, the skin looks like that of a buffalo, thick skin, and the colors also could be of multiple varieties, they are called as a Shudra. Now, this is a very unique type of classification of the snakes and their behavior patterns in Ayurvedic point. Now, in general, the consequences of the snake bite would be kopayanti anilam jantoh paninas sarvayevadu pittam mandalinaschapi kapham cha anekarajayah apatya asavarnabhyam dvidoshakaralakshanam jeno dosheshti dampatyoho. Now, in general, the funny hooded animals, hooded snakes, they tend to produce vataja vyadhi, neurotoxic symptoms. Mandalinaha kaphancha anekarajayah, they tend to produce pittam. Mandalinaha pittaja lakshanas are produced. That's mainly that of hemotoxic like symptoms. And anekarajayah, rajyaha, that rajiman, they tend to produce the clinical symptoms of kapha, most of the time anaphylactic shock like conditions, allergic phenomena. Then apatya samavarnabhyam didoshakara lakshanam, those which are crossbred or hybrid varieties, they tend to produce the vidoshaja lakshana, and the vidosha lakshana, which of the doshas would be involved would be depending upon the parent types. Like if it is a newborn from a Fani and Mandala, then it will be Vata and Pitta. If it is a Fani and Anekaraji, then it will be Vata and Kapha. That's how the symptoms are produced. And this is a very interesting issue. The consequence of the snake bite is depending upon the types, and which is absolutely true even now. Further on, if the consequences of the snake bite also depend upon the time of the snake bite or other external factors which can also be impacting the intensity of the clinical consequence of the snake bite. And they are Rajanyaha Paschime Yame Sarpaha Chitraha Charandihi Chesheshu Ukteshu Mandalinaha Diva Darvikaraha Sudraha Darvikarastu Karunaha Vruddhaha Mandalina Sudra Rajimanto Vayomadhyaha Jayante Mrityuhetavaha. Now, in general, the funny, that's hooded snakes, they tend to move around at night, and when they bite at the end of the night, the consequences will be more, it can become fatal. The mandala, that's the crates and vipers, they tend to move around in the daytime, and when they bite in the daytime, their intensity will be also more, and they often result in fatal complications. The hooded snakes, which are young, they have more poison, whereas older crates and mandalas, that's crates and vipers, they have more poison. Rajimantaha, that those snakes with the lines over the surface of the body, they are having more poison in the young age as such. Nakula akulitaha balaha vari viprahataha kushaha vruddhaha muktattvajobhitaha sarpastu alpavishaha smutaha. Those snakes which are hurt by the mongoose, Nakula is mongoose as such, and those which are hurt by them, or those which are affected by either water or maybe some other mechanical injury, which are weaker and very old, and immediately after their deskinning, see, snakes, they would have that layers of the skin expelled out, and after that process, immediately after the process of removal of that outer layer, are those which are really afraid of, their poison content would be lesser. So, such will have lesser poison contents. Now, furthermore, among the species, the names of the snakes, types or species are mentioned as such, and this, of course, is very practically difficult to identify which of these snakes are. So, we'll just casually read out the names. Among the Darvikara, 20 of the Darvikara, Krishna Sarpaha, Mahakrishnaha, Krishnodaraha, Shvetakapotaha, Mahakapotaha, Balahako, Mahasarpaha, Shankakapotaha, Lohitakshaha, Gavedukaha, Thalisarpaha, Khandapanaha, Kakudaha, Padmaha, Mahapagmaha, Dharpapushpaha, Dajimukaha, Pundarikaha, Bhrukutimukaha, Vishkiraha, Pushpabikirnaha, Girisarpaha, Rujusarpaha, Shvetodara, Mahashira, Alagarda, Ashi Visha iti, the 20 varieties of the Darvikara, hooded snakes, And of course, to identify and to equate them with the current biology knowledge would be practically very difficult. It requires a lot of experience and exposure to this biology. So we'll just casually look at it. Then among the mandala, the Adarsha mandala, Shweta mandala, Rakta mandala, Chitra mandala, Prishato, Rothra pushpo, Milindako, Gonaso, Vruddha gonasa, Panasa, Mahapanasa, Venupatrakaha, Shishuko madanaha, Palindiraha, Pingalaha, Tantukaha, Pushpapanduhu, Shadangaha, Adnikaha, Babruhu, Kashayaha, Kalusha, Paravato, Hastavaranaha, Chitrakaha, Enipada iti. राजिमंतस्तु पुंडरीको राजिचित्रो अंगुलराजिः बिंदुराजिः कर्दमकः तृणशोषकः सर्षपकः श्वेतहनुः दर्भपुष्पश्चक्रकः गोधूमकः किक्किसादः इति निर्विशास्तु गलगौरी शूकपुत्रो अजगरः दिव्यकः वर्षाहिकः पुष्पशकली ज्योतिरथः क्षीरिकापुष्पको अहिपताको अंदाहिको गौराहिको वृक्षेशयः इति वैकरञ्जास्तु त्रयाणां द्रवीकरादीनां व्यतिकराज्जाताः Vaikaranja are the hybrids which are produced due to the cross fertilization of the different types of these snakes, and they are Makulihi, Potagalaha, Snigdharajihi iti. Tatra Krishna Sarpena Gunastyam Vaipratyena va jato Makulihi, Rajilena Gunastyam Vaipratyena va jataha Potagalaha, Krishna Sarpena Rajamatyam Vaipratyena va jataha Snigdharajihi iti. Tesham Adyasya Pitruvad Vishotkarsha Dvayoho Matrabhadityeke. Now among those hybrid or crossbred snakes, according to Sushruta, the parents of these the snakes are Makuli is produced due to Krishna Sarpa and Gonasi types of the snakes having that copulation, and Rajila and Gonasi they produce Potagala, and Krishna Sarpa and Rajimati they will produce Snigdharaji, and their clinical impact will be based upon the parents as such. Then Trayana Maikaranjanam Punar Divya Eraka Rodhra Pushpaka Rajichitraka Potagala Pushpabhikirna Darbha Pushpa Velichakaha Satta Tesha Madhya Trayo Rajilavat Shesha Mandalivat Ev Metesham Sarpanam Ashitir Vyakshataha. The 80 types of the snakes are described here. Now, to identify whether the snake is a male or female, the sex of the snake is identified. According to Sushruta, the sexual characters are identified by looking at the appearance of the eyes and the tongue and the head as such. Sukshma netra jihvasya shirasa striyaha ubhaya lakshanaha mandavishaha akrodaha napumsakaha iti. Tatra mahanetra jihvasya shirasa pumamsaha. Those which have a bigger eye and bigger tongue are considered as a male according to Sushruta, and whereas those which have a relatively smaller eye and smaller tongue, they are called as they are categorized as female. Whereas Ubhayalakshana, which have both, they are Napumsakaha, hermaphrodites. Now, in the present days, according to the present days biology, the shape of the head is not a character by which you identify the sex of the snakes. Instead, sex of the snake is identified by looking at the shape of the tail and the presence of these genital organs. Male snakes have a rather a thicker and longer tail. Males, they have thicker and longer tail compared to females, and the male tail would be tapering differently from the tip to the thin at the tip. Suddenly it becomes tapered, whereas female one would be tapering evenly. That's how the shape of the tail is seen. And moreover, in the biology experiments, like to identify the snakes, usually the sex of the snakes, usually you use a probe called a sexing probe, and sexing probe is when it is inserted into the cloaca, that opening. In male it crosses only about 3 segments, whereas in female it crosses about 4 to 5 segments. That opening is quite longer than. Moreover, in a male you may see a what we call as a hemipenis. Hemipenis, a small penis like projection, may be seen at the cloaca. This is how the sex of snake is determined in a biology, current biology section as such. Whereas Sushruta attributes it to the shape of the head and neck. It's an issue of controversy. Who is right, who is wrong? Of course, that we will not go into that part. Now, coming to the clinical symptoms, तत्र सर्वेषां सर्पाणां सामान्यतः एव दशलक्षणं वक्ष्यामः. किं कारणं? विषं हि निशित निस्त्रिंश अशनिहुत अशनिहुतवः देश्यम् आशुकारी मुहूर्तम् अपि उपेक्षितम् आतुरमतिपातयति न च अवकाशो अस्ति वाक्समूहम् उपसर्तुं प्रत्येकमपि दष्टलक्षण अभिहितं सर्वत्र त्रैविध्यं भवति तस्मात् त्रैविध्यमेव वक्ष्यामः एतद्धि आतुरहितम् असम्मोहकरं च अपि च अत्रैव सर्वसर्पव्यञ्जन अवरोधः. Now the general clinical symptoms of the snake bite are described instead of going to the specific varieties. Reason given by Sushru is in a patient where the coming with the snake bite, you do not have sufficient time to go into the detailed inquiry because it's an emergency. Patient may die immediately. So you need to assess the clinical symptoms as early as possible and then treat the patients. And hence, instead of going to high details, the clinical symptoms are mentioned in a very brief and three categories as such, and those are तत्र द्रवीकरविषयेण त्वक् नयन नख दर्शन वदन मूत्रपुरीश दंशकृष्णत्वं रौक्ष्यं शिरसो गौरवं सन्धिवेदना कटिपृष्ठग्रीवा दौर्बल्यं जृम्भणं वेपतुः स्वरावसादः गुर्घुरकः जडता शुष्कोद्गार काशश्वासो हिक्का वायोः ऊर्ध्वगमनं शूल उद्वेष्टनं तृष्णा लालस्रावः पेनागमनं स्रोतो अवरोधः ताताश्च वातवेदनाः भवन्ति. In the Darvikara hooded snakes, of course, one of the basic issue in all snake bites is the identification of the snake and planning accordingly. And whenever there is identification is not possible, and most of the times identification is not possible because the location where the bite has occurred and the location where the patient is examined may not have that kind of a link that where it can be identified. Rarely you may come across patients who may have identified the snake type, or some may have brought the snake which has bitten into the hospital, so on. But otherwise, majority of the situations it is not possible. And the majority of the situations, the clinical the diagnosis has to be based upon the clinical science only. And the Darvikara, the hooded snakes, Syllabidae snakes, they tend to produce neurological symptoms. And those neurological symptoms are, there could be a blackish color or cyanotic changes in the body, a roughness, and there could be pain in the joints. Patients may have localized neurological deficit, Kati Krishna Kriba Daurbalyam, that's the localized neurological deficit can occur. There could be foamy breathing or foamy salivation because of the impaired breathing efforts. The voice may be affected, or there could be abnormal sounds produced as a hiccup could be occurring, or all the other clinical symptoms of blockade of the tracts, mainly the respiratory tract blockade can occur due to the laryngeal edema, and these are the clinical signs of Darvikara Visha or hooded animals. That's absolutely true. Mandali Vishena Togadinam Pitatum Shitabhilasha Paridupan Dahat Krishna Madhu Murcha Jwaraha Shonitagamnam Murdham Adashta Mamsanam Avashatanam Shvetu Damshakotaha Pitarupadarsanam Ashukopahastashtapitavedana Bhavanti. Mandala creeds and the vipers, they are hematoxic, and there the clinical symptoms will be at the site of injury. There could be a lot of swelling, and there could be reddish discoloration or yellowish discoloration, and there could be bleeding from different sides. That coagulopathies, they tend to occur different, that bleeding which is a real fatal issue, or it can result in necrosis, gangrenous changes in the body, and or at the site of the injury there could be blood gangrenous changes. That's exactly the clinical signs of hematotoxicity. So even Sushruta has categorized that hemotoxic and neurotoxic symptoms exactly in the same manner as it is seen now. Rajimad Visheshena Shuklatvam Togadinam Shitadvaraha Romaharshaha Stabdatvam Gatranam Adamshashobha Sandra Kapapraseka Chaddihi Abhikshna Mokshno Kandu Kante Shvetu Gurburakaha Uchvasa Nirodha Tamak Praveshastastasha Kapavedana Bhavanti. In the Rajimak variety, there could be pallor and there could be Shitadvara, a feeling of coldness, and chills may be occurring, numbness over the body. There could be swelling at the site of the injury as well as throughout the body, or even there could be salivation. Itching is the more common symptoms, and there could be edema, which is often seen due to hypersensitive reactions, what we call as allergic reactions. Anaphylactic shock like symptoms can occur. Now, anaphylactic symptoms in a case of snake bite can occur even in a non-venomous snake, or many times a anaphylide reaction can occur due to simply the apprehension that there is no contamination, no chemical transmission, but simply because of the fear a patient may have the clinical symptoms which are anaphylactic, and hence that's the important issue. Now, Purushabhidastah urdhvam prekshate adhastat striyaha sirashta uttishtanti lalate napumsakabhidastha tiryak prekshi bhavati. Now, this is again very unique issue, which is not really maybe substantiated by the current knowledge of pathology. According to Sushruta, a male snake, if it is bites, the patient will be having the eyeballs looking upwards, whereas if it is a female, then the eyeballs will be looking downwards, and there will be prominent veins on the forehead. And if it is by the napumsaka, hermaphrodite snake, the eyes will be horizontal, straight as such. Then Garbhinyah Pandamukhodnatasya Sutikaya Kukshishulartha Saridiram Mehadi Upanjivikatasya Bhavati Grasarthina Annam Kamshati Vruddhena Chiran Mandanasya Begaha Balena Ashum Mudavasya Nirvishena Abhishalingam Andahikena Andatvamiteke Grasanat Ajakaraha Sharira Pranaharo Namishat. Now, the other clinical symptoms, variations could be, if it is a pregnant snake, then the patient would have a pallor around the mouth, or the face will be paler. If the snake is during the menstrual period, that cycle, menstrual cycle, then the person who is bitten would have more pain in the abdomen. And if there would be even this hematuria, person may have a hematuria, and there could be swelling in the oral cavity. If the snake is hungry, then the person who is bitten also would be hungry. He will become hungry and he demands for the food. If it is a old snake, then the clinical symptoms produced will be delayed and the intensity of the symptoms will be milder. Whereas if it is a young, very young snake, or there is premature snake as such, then the snake symptoms may occur rapidly, but they are milder symptoms as such. Nirveshana Vishalingam, non-poisonous, will not produce any non-poisonous. Andahika variety of the snake may produce blindness. Ajagara variety can even produce a fatal complication not by poison but by swallowing. That pythons, Ajagaras are pythons, they may swallow the human being or damage the tissue mechanically, but they are non-poisonous. तत्र सद्य प्राणहराः दिष्टाः अहिरसः प्रतति शास्त्र अशनिहत इव भूमौ सस्तांगस्वपिति. A very strong poisonous patient may have an instantaneous loss of consciousness and the patient may die. Now that instantaneous loss of consciousness after a snake bite is mostly due to the shock produced due to the fear of the snake, or maybe anaphylaxis, not the poisonous effects. Now, the Vishavegas, the actual development of the clinical signs of the snake poisons, they would be stage by stage and they are described as the Vegas, and their clinical symptoms will be depending upon whether it is a Darvikara Visha or Mandal Visha, or a neurotoxic snake bite or hemotoxic snake bite, or maybe anaphylactic symptoms. And the symptom evolution would be तत्र द्रवीकरणां प्रथमे वेगे विषं शोणितं दूषयति तत् प्रदुष्टं कृष्णतामुपैति तेन कार्ष्ण्यं पिपीलिकापरिसर्पणमिव चाङ्गे भवति. The first symptom which would occur due to the hooded animals or neurotoxic snakes would be the blood would be contaminated, and hence the patient may have a blackish discoloration or cyanotic symptoms could occur, and the patient may have a tingling sensation over the surface of the body. The next stage would be Ditiya Mamsam Dushayati, Tena Atyantam Krishnata, Shofo, Grantayascha Ange Bhavanti. The next stage would be the Mamsa would be involved, where the patient would have much deeper blackish color, cyanosis becomes more pronounced, and there could be local swelling and local nodular swellings could occur. Tritiye Medo Dushayati, Tena Damshakledaha, Shirogauram, Svedaha, Chakshur Grahanamcha. When the Medo Dhatu is involved in the third level of the poisoning impact, there would be discharges at the site of the bite, Patient may have a heaviness in the head, sweating could occur, eyes may be blurred, the vision may be blurred. चतुर्थं कोष्ठं अनुप्रविश्य कफप्रधानान् दोषान् दूषयति तेन तन्द्रा प्रसेक सन्धिविश्लेषाः भवन्ति. The next level, it involves the kosta, the body cavities, and it produces clinical symptoms related to the kapha like salivation or these joint disabilities of the joint would occur. Panchame, in the fifth level, अस्थिनि अनुप्रविश्य प्राणम् अग्निञ्च दूषयति तेन पर्वभेदः हिक्काः दाहश्च भवति. In the next level, because it involves the asthi, there could be involvement of the vitality of the body and even the digestive capacity, metabolic parts of the body could be affected, and hence the patient may have impaired movements, hiccup, burning sensation, etc. षष्ठे मज्जानम् अनुप्रविशति ग्रहणीं च अत्यर्थं दूषयति तेन गात्राणां गौरवम् अतिसारः हृत्पीडा मूर्छा च भवति. In the sixth level, higher level, because majja is involved, the patient may have a severe impairment of the digestive capacity of the abdomen, and hence there could be heaviness, even diarrhea-like symptoms, pain in the chest, or unconsciousness may occur. सप्तमे शुक्रम अनुप्रविशति व्यानं च अत्यर्थं कोपयति कफं च सूक्ष्मस्रोतोभ्यः प्रत्यावयति तेन श्लेष्मवर्ति प्रादुर्भावः कटिपृष्ठभङ्गः सर्वचेष्टाविघातः लालास्वेदयोः अतिप्रवृत्तिः उच्छ्वासनिरोधश्च. When the shukra dhatu, the seventh level is reached, because all the channels of the body are blocked, and hence there will be a prominent neurotoxic clinical symptoms. There will be salivation, and you will see that the foam coming through the mouth. Shleshmavarti is the saliva foam coming through the mouth, and there could be complete loss of stability of the body, kati prastabandha. All movements may be lost. The neurological symptoms of the loss of movement could occur, and there could be uchhasa nirodha, respiratory blockade due to the saliva. It is one of the very classical clinical symptoms developing in case of the neurotoxic snake bite, and it's perfectly same even now with all the contemporary descriptions of the snake bite. It's exactly the same, very perfect as it. Then mandalinam prathame vege visham shonitam dushayati tat pradashtam pitaram priti tatra paridaha pitava bhasata changanam bhavati. In a hemotoxic condition, initially it will be again shonita dushti, and there will be a discoloration of the body, burning sensation also can occur. द्वितीय मांसं दूषयति तेन अत्यर्थं पीतः परिलाहः दंशे श्वेतश्च भवति. Local swellings would become more prominent when the second level, when the mansa is involved. तृतीय मेदो दूषयति तेन पूर्व चक्षुर्ग्रहणम्. In the medo dushti, in the third level, same clinical symptoms as that of the mandala Dravikara snake bite also could be seen, and the eyes would be involved. Trishna damshakledaha svedashcha, there could be more discharges at the site of the injury as well as sweating. Chaturthe kostam anuprabhisha jvaramapadayati. In the fourth level, it because it involves the body cavities, there could be fever, and panchame paridaham sarvaghatreshu karoti. Shashte shaptameho purvata. In the higher level, the clinical symptoms resemble that of the neurotoxic condition. राजिमतां प्रथमे वेगे विषं शोणितं दूषयति तत् प्रदुष्टं पाण्डुतामुपैति तेन रोमहर्षः शुक्लाभासश्च पुरुषो भवति. In the first wave of Rajimat, anaphylactic shock conditions, there could be a pallor and romaharsha, that pilar erection of the hair should occur, and the patient may look pale. द्वितीय मांसं दूषयति तेन पाण्डुता अत्यर्थं जाड्यं शिरस्सोफश्च भवति. There could be a swelling over the forehead, and the pallor will become more prominent. Medo dushayati tena chakshur grahanam damshakledaha. When the medo is involved, there could be involvement of the vision and damshakledaha. At the point where there could bite, there is a discharge. And chaturthe kostam manopravisha manyastambam shirogauram cha apadayati. Then in the next level, there could be torticollis defect, spasm of the muscles, and heaviness in the head also can occur. Panchame vaksangha shitadvaram cha karoti, shashya saptameham purvata. So the clinical symptoms will be intensing as such. Bhavanti chatra धात्तंत्रेषु या सप्तकलाः सम्परिकेत्रः तासु एकैकाम् अतिक्रम्य वेगं प्रकृते विषं येन अंतरेण तु कलां कालकल्पं भिनत्तिः समीरणेन औक्ष्यमानं तु तत्तु वेगान्तरं स्मृतम्. Now the kala in between the dhatus, they are the barriers for the spread of the clinical symptoms, and the time taken for that the evolution of the clinical symptoms will be also depending upon the eminence of these kala, so that they produce a kala kalpa. There could be a kala kalpa, that's the different types, grades of the time taken in addition to the intensity of the venum as such. And so you have to analyze these specifically. शूनांगम प्रथमे वेगे पशु ध्यायति दुःखितः लालास्रावो द्वितीये तु कृष्णांगम पीडते हृदि तृतीये च शिरो दुःखं कंठभ्रीमं च भज्यते चतुर्थे वेपते मूढः खादन् दन्तान् जहात्यशून् केचित् वेगत्रयं प्राहुः अन्तं च एतेषु तद्विदः ध्यायति प्रथमे वेगे पक्षी मुह्यति अतः परं द्वितीये विह्वलप्रोक्तः तृतीये मृत्युं छति केचिदेकं विहङ्गेषु विषवेगम् उशन्ति मार्जारनकुलादीनां विषं नातिप्रवर्तते. Now the another summarized method of describing these vegas are: in the Prathama Vega there would be a local swelling, and the Ditiya Vega there would be salivation, and in the Tritiya Vega there would be headache, and there could be pain in the neck as such. In the fourth Vega, the patient may have even abnormal movements of the body and death can occur. So this is another way of defining the Vegas. 4 Vegas are described, or certain of the other people had described the 3 Vegas, Kinchit Vegatrayam. So Sapta Vegas are the classical Vegas which are mentioned in Sushruta. The other versions at that time are either some would be considering 4 levels, some would be considering 3 layers, and the 3 levels are Dhyayati Prathame Vege Pakshi Mushyat Param. The Prathama Vega, the patient may become unconscious. Ditiya Vishwala, in the second he may become disturbed, and there will be a significant abnormal behavior, and in the Tritiya Vega there could be death also, because these symptoms also are seen in the birds which have become poisonous. So when the birds become poisonous, it is the same, and in the cats and mongoose, the poisonous Vegas may not be seen as such. This is what Sushruta says about it. From the present clinical point of view, in general, the snake bites, most of the snake bite victims survive, and even without antivenom. Antivenom is necessary only in a few of the patients where the real venom has occurred. Deaths are mainly due to either intravenous deposition of the venom. So when antivenom is prescribed, your improper dosage and improper route of administration of venom could be a cause for the death in majority of the cases, or it could be due to the anaphylaxis, not really due to the poisonous effect. Non-immune anaphylactic reactions also can, as I told you, non-immune anaphylactic reactions are simply the psychological shock, fear. By looking at the snake, you may have the fear, and that itself can produce the complication. Systemic toxicity, either that of the neurotoxic or hematoxicity producing the cause of death, are relatively lesser. Whenever the snake bite occurs, a patient comes to you, the most important is identification of the snake and the local signs. Local signs, though theory describes about the same issue like that facts and the shapes of the bite, most of the times the patient would have a lot of other local complications which will give that grading. Exactly the same as mentioned in Sushruta. Either there could be a localized edema, as in case of what Sushruta says as Kapaja Lakshanas, or there could be a gangrenous or accumulation of these hematotoxic symptoms. Though the bite mark might be somewhere, the complications of hemorrhagic signs, hematotoxic signs, may be elsewhere. Based upon that, you may have to consider the degree of that. The clinical signs are hematotoxic bite signs are nausea, headache, lightheadedness, and there could be hypotension, swelling, coagulopathies. Neurological toxicities are, whereas neurotoxic signs, the typical clinical symptoms are labor breathing and tachycardia, weak pulse, low blood pressure, disturbed vision. Now, anxiety, confusion, frothy saliva, slurred speech, or they usually occur within 8 hours in 94%. Sometimes it may take up to about 24 hours also. That's the important thing. But important is the clinical symptoms which are mentioned here, they are exactly the replica of what Sushila has mentioned. The main investigations which are required now are assessment of the bleeding time, that's prothrombin in more than 15 seconds in the patients who have hemotoxicity. Fibrinogen may be lesser. Thrombocytopenia also are the clinical signs which are the important guidelines to plan the management in hemotoxic. Snakebite severity is assessed by a generalized universal score, snakebite severity score flow chart. And in the flow sheet, the clinical symptoms are assessed in terms of pulmonary symptoms, cardiovascular symptoms, local wound signs, gastrointestinal symptoms, and hematologic symptoms, central nervous systems, and they are given the points. The maximum will be 27, and if this number is more than 5, then the patient needs to be observed. Less than 5 is considered as a non-toxic. 5 to 15 is considered as a toxic, where you have to observe and see whether the patient really requires a venom or not. Antivenom may not be necessary, whereas if it is more than 15, then the antivenom may be necessary. As far as the first aid is concerned, the guidelines for first aid given by the universal WHO, and there is a snakebite guideline, Indian guideline protocol given by Swati Chitra Tirunal Medical Institution, Kerala. Very interesting issues. In the universal guideline, the first aid is suggested as apply pressure to the bite site with a pressure pad. Avoid traditional first aid methods like herbal medicines and other unproven or safe herbs. So herbal medicines, they are mentioned as to be avoided in the universal guideline of the first aid, and that's why I have made it as red. Then transport the person to a health facility as soon as possible. Give paracetamol for local pain. Pain management is one of the important issues. Immediately move away from the area where the bite has occurred. Remove anything tight from around the bitten part of the body. Reassure the victim. So earlier concept or general folklore concept of treating a patient of snake bite would be you remove the venom from the area of the bite by biting this, maybe making the blood flow. But that kind of a protocol of whatever we call as raktamokshana, or maybe all that sort of cutting of the tissues and so on, they are practically useful only if it is done within 2 minutes. The time taken for the venom to get fixed to the tissue is 2 minutes. If you can suck out the poison within 2 minutes, then only it can be effective, otherwise not. So, and most of the times you will not get that kind of an opportunity, and handling the tissues after 2 minutes can increase the chances of the poison getting contaminated. And the general protocol would be to wash off the wound as far as possible. But Swati Chitra Tirunal Medical Institution given specific guideline for the Indian guideline protocol, and Swati Chitra Tirunal is in Kerala, and very interestingly, Kerala is a state where the folklore practices or maybe the traditional practitioners are successfully handling the snake bites with their protocol. And the comment coming from the Swati Chitra Tirunal Medical Institution, the guideline is do not apply a tourniquet. Do not wash the bite site with the soap or any other solution to remove the venom. Do not make cuts or incisions or near the bitten area. Do not use electric shock. Do not freeze or apply extreme cold to the area of the bite. Do not apply any kind of potentially harmful herbal or folk remedy. Do not attempt to suck out the venom with your mouth. Do not give the victim drink, alcohol or other drugs as such. Now, this is now this kind of a guideline, which is very unique in the sense, it's against the general concepts. The general concepts are tie a tourniquet so that the poison doesn't get determined. Now, the older versions where the tourniquet were to be suggested, whereas the current guidelines are just the opposite as such. And particularly that guideline given by a Kerala Medical Institution and as considered as a Indian guideline and protocol for the snake bite, controversial issues. I will not comment beyond that, but the reason for this kind of a controversy, it's something which is beyond our perception. Then the simple management principles of a snake bite is, the first of the thing is you have to recognize immediately life-threatening conditions, provide analgesia, assess the local and systemic toxicity, minimize local tissue damage, prevent or correct any systemic toxicity like hypertension and weakness, so you may have to give IV fluid and so on. And hematological toxicity has to be corrected or prevented by giving coagulants, like then limb function has to be improved, minimize harm from unnecessary potential dangerous interventions. With this, we will conclude. It is social संहितायां कल्पस्थाने सर्पदष्टविषविज्ञानं नाम चतुर्थोऽध्यायः. I will not go into the issue of antivenoms, their that classification, etc. That part we will just leave it as such. With this we will conclude. If there are any questions, we will try to answer and then wind up today. Right? Okay, there are no questions, so we will wind up.